I would like to acknowledge the Daro people who are the traditional custodians of the land. We pay our respects to the elders past and present of this nation and extend that respect to all the other Aboriginal people. Establishing the need for change. Why should we focus on quality and safety? The first point is increased incidence of medication errors and patient falls. Medication without harm, which was set to reduce medication related hospitalizations by the year 2025 by 50%. This progress towards the goal consists 10% reduction of insulin-related adverse events in the recent period, which indicates the work being done on medication safety in healthcare facilities. The second point is impact on the outcome of patient satisfaction and health services. Recent data shows that hospital-acquired complications continue to be a significant problem in Australian healthcare, with about 149,700 hospitalizations in 2022 to 2023, reporting at least one complication which results in prolonged stay in hospital and increased cost of healthcare services, which leads to lowered patient satisfaction. This can be solved by addressing the gaps to improve overall healthcare quality. The third point is resources and cost implications. Shortcoming in quality and safety creates pressure on the available resources, raises operational expenses, and leaves the hospital vulnerable to compensations. The last but not the least, alignment with national and organizational standards. Most of the general healthcare related guidelines like National Safety and Quality Health Service standards help in achieving safer healthcare delivery system for both patient and staff. Hello everyone, my name is Sonia Rai and I serve as a Quality and Safety Officer at Sunshine Hospital. In my role, I'm responsible for identifying, implementing, and overseeing strategies that enhance patient safety and the overall quality of care. My primary focus is on introducing change process that help prevent incidents and ensure a safer healthcare environment. There are two purposes of this quality and safety initiative. First, it aims to directly enhance patient safety and the quality of care we provide. Second, it supports a culture of continuous improvement where every team member is engaged in elevating care standards and outcomes for our patients. Through these efforts, we hope to create a healthcare environment where safety and quality are integral to every process and interaction. Organization setting of the 500-bed urban hospital. In our 500-bed hospital, we provide care to a metropolitan population and the demands they require. Our hospital has numerous departments which include emergency ward, intensive care unit, maternity, outpatient services, and rehabilitation. Advanced facilities and technologies. Well equipped with all the medical amenities and telemedicine adopted as part of our healthcare technology, our focus is to provide utmost comfort to the patients and effective organization in the operation theater. The third point is diverse patient demographics. All our services are culturally sensitive and managing a variety of socioeconomic as well as health issues that are likely to be faced. Also, there is an educational focus where we join other organizations in the provision of preventive services, disease education, and health fairs. This method enables a healthcare organization to address simple and complex healthcare needs of a community to achieve both short and long-term objectives. Now, let's walk through the structure of today's presentation, which is designed to address a critical quality and safety initiative in healthcare. First, we have introduction. We will start by discussing the importance of quality and safety in healthcare, highlighting major issues like medication errors and patient falls, which are common concerns impacting patient outcomes. Second, we talk about rationale for improvement. We will cover the evidence-based need for improvement. This section will emphasize why this initiative is necessary and how it aligns with national healthcare standards, ensuring our goals are clear and well supported. Third, we talk about interventions and implementation plan. where I will introduce specific solutions, outline the steps for implementation, and discuss the roles of key stakeholders who will drive this change within the organization. And at last, we will talk about conclusion and takeaways. We will summarize the anticipated impact of these efforts on patient safety and overall healthcare quality. This section will provide a perspective on how our initiative will contribute to a safer healthcare environment. The rationale for our quality and safety improvement initiative is grounded in pressing evidence. First, frequent issues like medication errors and patient falls lead to adverse outcomes and compromise patient satisfaction. According to the Australian Commission on Safety and Quality in Healthcare 2024, such incidents remain a top concern across healthcare settings. Additionally, poor safety standards contribute to higher readmission rates and longer hospital stays, which drive up healthcare costs. Furthermore, implementing this initiative aligns with best practices adhering to national safety standards and our organization's commitment to patient care excellence. Lastly, by reducing resource wastage through enhanced protocols, we can optimize time and cost, creating a more sustainable healthcare environment. Rationale for quality and safety improvement. Our quality and safety improvement plan is designed with four key objectives to enhance patient care and hospital efficiency. First, we aim to reduce preventable incidents, particularly medication errors and patient falls, which are persistent safety challenges in healthcare. This focus directly addresses critical areas where improvements can save lives. Second, by implementing these targeted safety measures, we expect to improve patient outcomes, reducing readmission rates, shortening hospital stays, and boosting overall satisfaction. Research supports that better safety protocols lead to both clinical and operational benefits. Third, improving quality and safety will also create cost efficiencies. By minimizing errors and optimizing processes, the hospital can reduce resource waste and allocate funds more effectively. Finally, this initiative aligns with national healthcare standards, reinforcing our commitment to quality and compliance. Through these measures, we are not only addressing safety concerns but also positioning our hospital as a leader in high-quality patient-centered care. Our first intervention focuses on fall prevention program aimed at reducing patient falls, a common and preventable issue, especially in patients with low mobility. Research highlights that fall-related injuries can be significantly decreased through structured risk assessment and frequent monitoring. The main objective here is to reduce falls by implementing brief, hourly rounding across all units and conducting comprehensive fall risk assessment. For instance, Harris found that fall risk assessments can lower the incidence of falls by up to 31%, demonstrating the effectiveness of proactive monitoring. We anticipate that this intervention will lead to fewer fall-related injuries, higher patient safety scores, and improved satisfaction levels. The impact of this approach is substantial because nurses and caregivers can address risk before a fall occurs, as supported by findings from Ryan. Through this structured assessment, we aim to create a safer environment for our patients, enhancing both their physical safety and overall experience. Medication errors are a significant concern in healthcare settings, often leading to adverse patient outcomes. Our medication safety protocol focuses on minimizing these errors by standardizing the medication administration process. The goal here is clear: reduce medication errors by implementing a standardized system. Method: we propose using electronic medication administration records or EMAR alongside double-checking process, especially for high-risk medications. Research by Pruitt has shown that adopting EMAR can reduce medication errors by up to 40%. Expected outcomes: By implementing this approach, we anticipate a reduction in medication errors, fewer drug-related complications, and increased confidence among staff in medication administration. Impact: this protocol aligns with other best practice in medication safety, improving precision in medication delivery, which, as noted by Naidu and Alicia, reduces potential hazards to patient health. In summary, the medication safety protocol will not only streamline processes but also bolster patient safety by decreasing risk associated with medication errors. In this implementation plan, we have broken down the intervention into four clear phases: preparation, training, implementation, and monitoring and evaluation. Each phase is designed to ensure a smooth, systematic rollout of the intervention with specific timelines and milestones. Preparation phase. This includes baseline data collection and the development of training modules. Key stakeholders, such as quality team members and trainers, are involved to ensure we have accurate data and tailored training materials ready. The second phase, also the training phase. Here, we focus on equipping our staff with the necessary skills through comprehensive training sessions on both fall prevention rounding and the use of electronic medication administration records, which is also known as EMAR. This phase is critical as it ensures all involved staff are prepared and knowledgeable about the interventions. The third phase, implementation phase, this is the main execution phase where the protocols are put into practice. Nursing staff begin hourly rounding and EMAR protocols are adopted to standardize medication administration. IT support is available to troubleshoot any issues with EMAR, ensuring smooth integration. The fourth phase, also the monitoring and evaluation phase. To access effectiveness, monthly data reviews will track the reduction in fall incidents and medication errors. This allows us to make any necessary adjustment and confirm that the interventions are having the desired impact. In the first part of our implementation plan, we focus on preparation and training to establish a strong foundation for our interventions. In phase 1, we start by gathering baseline data on current fall rates and medication errors, giving us a benchmark to measure progress. The preparation phase also includes developing customized training modules and creating protocols for using the electronic medication administration records EMAR system, with involvement from the quality team, IT staff, and nursing leadership. In phase 2, training, we aim to train 90% of nursing and medical staff on fall prevention and EMAR uses within a month. This phase includes a structured training sessions along with follow-up opportunities to ensure all the staff are confident and prepared. By the end of this phase, we will have a well-informed team ready to implement these interventions effectively. In the second part of our implementation plan, phase 3 focuses on the actual implementation of our interventions. During this phase, hourly roundings for fall prevention is initiated in high-risk areas and the EMAR protocols are activated across departments. Weekly monitoring will ensure compliance and we will collect data to measure early outcomes. This phase relies on nursing staff, ward managers, and IT support to ensure both fall prevention and medication protocols are consistently followed. Finally, in phase 4, monitoring and evaluation, we track and evaluate the results of our interventions. Monthly reports will help us measure the reduction in fall rates and medication errors, with a target of 20% decrease in incidents. Additionally, quarterly reviews will allow us to make adjustments to the protocols based on the data collected. This phase promotes a continuous improvement approach, allowing us to refine our strategies over time to maintain high standards of quality and safety. This intervention plan addresses two critical areas for patient safety. The one is fall prevention, and the second one is medication safety. Both are essential for improving the quality of care and reducing risk to the patient. The key discussion points are: our approach includes comprehensive preparation and training activities to equip staff with the skills and knowledge needed for their roles. Proper training not only enhances competency but ensures that staff can consistently apply best practices in both fall prevention and medication safety. Following a structured implementation approach is also vital. By adhering to a clear protocol, we ensure that standards are not only met but maintained throughout the intervention. This structured approach fosters consistency across teams and promotes accountability. Finally, we emphasize ongoing assessment and evaluation. Regular assessments allows us to create a feedback loop where we can continually monitor, adjust, and improve the intervention to maximize its effectiveness and sustainability. For the takeaway messages, the research underscores that evidence-based measures play a significant role in reducing fall rates and medication errors, directly impacting patient safety and outcomes. A phased, multi-stakeholder approach also enhances the intervention's effectiveness. Engaging a diverse group of stakeholders ensures that all perspectives are considered, creating a more resilient and adaptable program. Ultimately, patient safety is an ongoing process. Through evidence-based actions and clear results, we can continuously improve the quality of care. This intervention serves as a foundation for building a safer, more reliable healthcare environment. In summary, by focusing on preparation, structured implementation, and continuous improvement, we are taking concrete steps towards enhancing patient care and ensuring sustainable results. Thank you all for your attention and interest in our intervention plan for improving patient safety. For anyone who would like to learn more or discuss further, please feel free to reach out to us via email at qualityandsafety@sunshinehospital.org. We are here to answer any questions and provide additional resources or guidance. You can also scan the QR code on the slide, which will take you to more detailed information on the quality improvement, specifically focusing on our strategies in fall prevention and medication safety. Once again, thank you for being part of this essential conversation on enhancing healthcare quality and safety. We look forward to collaborating further to create a safer environment for all our patients and staff. Here are the references I used for this presentation. If you'd like to explore any of these resources in more detail, please feel free to ask.